Women can be even better than men and more committed.
It's a fantastic job. You get to meet brilliant people and do excellent work.
My husband's an accountant, he's not medical. He thinks that it's just wonderful if I'm called at night and go out to save a life.
If you have the confidence to pick up a scalpel and open up somebody, fix something and repair what you've done, it's tremendously exciting and rewarding.
I can't imagine doing anything else, and I don't want to do anything else, so I'm quite happy to make the odd sacrifice here and there.
It's not the success, it's not the happy surgical story, it's the impact we have on people's lives. If you do your job well and if you're kind and considerate, you don't have to be the world's greatest professor of neurosurgery.
Eleanor Davis Coley was the first female fellow of the Royal College of Surgeons of England. She joined in 1911. By 1919, there were 4 female fellows, and in 2009 that number had soared to 1,184.
I think society has changed, and there are some women, I hope I'm amongst them, who have pushed and made it easier for other women.
More and more women graduates are coming through, and it's no longer unusual to see women in training in surgery. Only today, I'm interviewing for a consultant post at Imperial in London, and the 2 best candidates who we have shortlisted are both women. So I think that's an example of how things have changed.
It's constantly thought of as a male-dominated specialty, and I think within surgery there are areas of surgery that are more male dominated, or that are perceived as more male dominated than female. I think the general public definitely in certain age groups expect that when I go and see them that I'm the nurse.
There's still the feeling in surgery that somehow you have, because it's physical, that you have to be quite big and strong to do it, and that's taken quite a while to work through, because you don't. It's a lot of it's skill and technique and doing things right the first time.
Women are now represented in all 9 surgical specialities, from paediatric surgery to trauma and orthopaedic surgery.
I think one of the main barriers that I've found is patient perceptions. So when they come to see me in clinic, despite my name being on the door, they expect a middle-aged man normally. And I've had a few occasions where I've had a middle-aged male healthcare assistant sat in the clinic with me, and a patient will direct their conversation to them rather than to me.
Every step you go, there are always going to be people who put you off. I specifically remember those people who put you off. And all I can just say is if you truly believe in something and you're passionate about it, you'll find a way. Because you're going to spend the whole of your life working, you might as well do something you enjoy. And if you never try, you'll always be thinking, what if? So I thought, forget this, I'm just as good as anyone else, I've got the passion to do it, and I'm going to go for it.
I was very much in the first cohort of female plastic surgeons coming through, so although we didn't have the role models to aspire to, we were very much working through as a group. So throughout my training as a plastic surgeon, I've known several other good girlfriends of mine who are at similar stages in training, so you never felt isolated in a man's world.
University of Exeter research has shown that when medical students and surgical trainees think of surgical consultants, they think of someone with masculine, macho characteristics. When they compare themselves with this macho surgeon stereotype, women are most likely to think that they don't fit in. This feeling of a lack of fit can reduce motivation to pursue a surgical career. It is these stereotypical beliefs, rather than reality, that are responsible for many promising female medical students opting out of a very rewarding career.
There are some hurdles around pregnancy and maternity, and there is a feeling that it's difficult to come back to work.
Getting married and having children is when I had to take a step back, and I ended up working as a part-time trainee for a short while, partly because it was quite scary being a mum and going back to work.
Now that surgical trainees can do flexible training and have their family and kids, and they don't have to wait till they're 40 to start thinking about their first baby. Once they finish the whole training, they can do that all during the training, which is a great advantage.
It's hard being pregnant. I had carpal tunnel syndrome in both my hands, and they were stiff and I couldn't work. It's hard to breastfeed. You feel exhausted all the time. Your hormones are all over the place. So having 2-3 months out is not quite as possible as I once thought it was. And so I've opted to go for 8 months of maternity leave.
It's something that people just don't want to venture into. They think it's almost unachievable. And I know when I first started, it was a case of, oh gosh, there's so many hurdles. But they're fun hurdles, and they're fun hurdles that you're doing with other people.
I think the long hours are tough, but you get used to it and you manage to put things in order in your life. But there's a moment in your training when you start finding situations in which you don't have the answer. And I think that's the toughest thing in surgery.
Surgery is quite a physical job because it's staying long time awake, especially when you're on call at night. When you're operating, it's standing a long time on your legs, which some people find very challenging as well. Sometimes you have no food for quite a long time. But once you get used to that, it comes with the job, really.
The NHS, GMC and RCS recognise the enormous value of women surgeons and actively work to understand women's experiences and to support their career progression through flexible training and by funding networks and professional events for women.
There was a huge amount of prejudice. I trained at Barts, and just before I qualified, the old professor wouldn't have women house surgeons in any job in Barts. He said they were too difficult for women. And there was a new professor, so he wanted to do everything differently, and so he took a woman house surgeon, which was me, and that really started me off.
It was a very elderly man, I remember. We got him well enough to be discharged, and there was a sudden telephone call to the ward where he collapsed, and he died basically as his family were coming to pick him up from something completely unrelated. 2 weeks afterwards, his family came back to the hospital specifically to bring me flowers. It's not the success, it's not the happy surgical story, but it's the impact we have on people's lives.
I can remember a 12-year-old boy just recently, and he had a big brain tumour and lots of pressure in his head, and his parents, as you might imagine, were terrified. I told them that there was a risk of death and there was a risk of major neurological damage. A few days later, told them that it was a benign tumour, and because I'd got it all out at the first operation, they'd gone in the space of a week from actually thinking their child was going to die to thinking actually, well, he's going back to school in a couple of weeks' time and everything's going to be fine.
The surgical profession needs people with excellent technical, administrative, communication, leadership and people skills. Individuals with different sets of skills will be able to find a speciality and a post that allows them to succeed.
I would ask them if they are going to do it for the money. If it's for the money, I would advise them to do something else. If they want to do it because of a sense of power, again, I would do something else. If they want to help people and if they want to be good scientists who can help, then I would tell them to do surgery.
There are multiple things that inspire us during our lives. A further moment that confirmed it was as a medical student, I was asked to participate in an operation, and I really enjoyed the whole feel of my hands inside the warm abdominal cavity, and I really thought to myself, this is definitely what I want to do.
When I got to medical school, I sort of realised I was surrounded by people that wanted to be doctors and wanted to help people and were very nice. And there was a bit of me feeling I didn't quite fit in. I mean, I do want to help people, but I wanted to actually fix something that needed fixing, rather than just talking about it all the time.
For a long time, I actually wanted to do surgery, but there was something in my mind which made me think, oh, surgery is full of chauvinistic males and it's not a place for women, and if I wanted to be a surgeon I'd have to choose between career and a family, and I didn't want to choose. I wanted to do both.
When you do see the results of what you do, whether it be simply retracting and assisting in an operation, but the fact that it makes such a difference to someone's life fairly immediately, it's fairly satisfying.
I always wanted to be a surgeon. I come from a family of artists, and I've spent a lot of my younger days building stages around with my father and, climbing up stages to build the lighting and mics. So maybe I always had to do DIY, so I'm in orthopaedics fixing things now.
So patients, definitely, being able to diagnose somebody with a problem, take him to theatre, fix it, and come back and say, I fixed your problem. Or at least I've made it easier for you if it's something that you can't cure.
It's not sort of up to your elbows in muscles and guts all the time. It's quite a balance, and I really like that.
I think the most rewarding aspect of my job is seeing patients satisfied with their treatment.
Achieving a work-life balance is one of the major concerns for female and male professionals in all parts of society. A surgical career, like many others, requires some level of sacrifice during training. University of Exeter research indicates that many successful surgeons, both female and male, manage to strike a well-balanced life and report finding this easier as they move through their training.
I think work-life balance is very important. From my own point of view, I do karate, which is great, and I drag the children along, so we pretend it's family time, but actually I enjoy it most, I think.
So the best thing I could have done for a work-life balance is have a family, so that I know that I have to get home, and as soon as I open that front door, unless there's a major catastrophe at work, it just all completely melts away.
Having your extracurricular activities really helps you as a doctor, because it's a vacation. You can't just live your life in the hospital. You've really got to live your life out there. And I found the better doctors are the ones who have passions outside of work as well.
I used to have hobbies before I had children, and I suspect that's the same for most people with a young family.
My husband's an accountant, he's not medical, and he thinks that it's just wonderful if I'm called at night and go out to save a life. I've been a doctor for 50 years and a consultant surgeon for 40 years. So I'm one of the old school. And when I became a consultant, I think there was 6 women consultant general surgeons in the UK. So huge transformation since then, really.
I can't imagine doing anything else, and I don't want to do anything else, so I'm quite happy to make the odd sacrifice here and there. And when you're a more junior trainee, with the hours that you have to work, it is a little bit more difficult, but as you get a bit more senior, I've found that I've got a really good work-life balance. I don't really have to not do anything. I still go on holidays, still go out with my friends all the time.
Take each day as it comes, really. If you start thinking about what the path is going to be and the challenges that are ahead, it'll just seem daunting. And I know a lot of 18-year-olds now just go, oh, no way, I'll just like have something easier to do, thanks very much. So just think about the next step and what you need to do for that step to get forward.
The environment in theatre is quite often quite relaxed. So the way that your theatre team relates to you, talks to you, it's very much on a level pegging. It's getting away from some of the hierarchical systems that we are used to in medicine.
Role models are really important. Because I didn't think I really fitted into surgery, it was only when I met kind of females a little bit further on from me that I realised actually it was something that I could do and was really achievable.
There were 3 females that made me think that by choosing surgery, I wasn't excluding being a mum or a wife.
I'm thinking of 2 of them because I really enjoy working with them. They're both microsurgeons. One of them is a breast surgeon and mother to 2 children. And I've been operating with her, doing long microsurgery with her pregnancy belly, and it's really fun. And she's really committed to her job and to her family, and I really like her. The other one is a lower limb surgeon, and she performs the best surgeries I've seen.
There was a staff grade in orthopaedics who really inspired me. He dragged me along almost physically to the operating list and then just let me get on with doing a lot of the stuff and show me how to do it. And I guess that's when I first thought, I can do this. I'm reasonably good at doing this.
It's about closing that perception-reality gap. I do as much brain surgery as some of my big strapping male colleagues, and I'd like to think I do it better and I'm more efficient at it, and my patients like me for communicating with them better.
Whether you look at your friends who are doing law or accountancy or any other professional job, I think you'll find they work very, very hard to become successful. And medicine and surgery are no different, but if you put a lot of effort in, you will enjoy it enormously.
You cannot become a surgeon on your own. You have to be trained by other surgeons, and they support you. And one day you find yourself supporting others, and all of this is done to provide something to the patients. So it's really special, I think.
And here is where I actually found there were normal women who were young, who were vibrant, who had families, and who were doing surgery as registrars and as consultants. And that really inspired me to think, actually, do you know what? If they can do it, I can do it.
I think go for it. I think I'm the sort of person who I think if you're very, very focused, you're very, very passionate about something, you only have one life to live. Just go for whatever you want to do. Surgery is a brilliant career.
be kind, passionate, considerate. I think these are the most important abilities. The technical skills, the book work, the knowledge, the background reading will happen. It's the quality of character that someone has to, for me, to have, which will allow them to progress.
It's a wonderful life. It really is. It isn't a job. It is a life's work. So, which is why I'm still doing it in retirement.